We came a long way this last year, and it wouldn't have happened as well as it did if we didn't have everybody that we have on our team. They always say, oh, it takes all kinds to make the world go round. Well, let me tell you, I am very grateful for the team of people that I didn't think that I would be working with. It was nice to know that someone always had your back. In this organization here, specifically, I have grown so much over the last 9 years. They supported me the whole time. They supported me when I went back for my LPN, kept me on, and then when I went back for my RN. So the support was tremendous. Without that, I probably wouldn't have been able to do that. And it's a nice feeling to feel like you have a community behind you saying, you can do this.
On my unit, I've been with some of the people, I started working with them over 20 years ago, so we're kind of like family already. And we've all become closer and bonded more throughout this. We had to work much closer than normal, and it's been a very trying year. But we made it through, so it's going to be okay.
Everyone was open here. I mean, it's a great environment. Everyone's approachable from the bottom up, and you're accepted when you walk in the doors.
You feel like an individual because you're respected in your role as an RN and your opinion counts, so that individually you can add to the team. So the answer would be both. I feel like an individual where you're valued for what individually you bring to the table. And then once that table is, everyone's seated at it, as a team, it's just cohesive. We couldn't exist unless we all worked together as a team. It just wouldn't happen.
At Cayuga Medical Center, I work in the OR. I love to work at Cayuga Medical Center because it has given me a great opportunity to advance my career as a nurse. I think I love the team approach. You can't do it all by yourself. We're like family. In the OR, those people are excellent.
The community, I think, should support Schuyler Hospital. The sense of pride that people have here in everything that we do. We worry with you, we cry with you, we feel how you feel. Just something that you get out of a smaller town community hospital versus a bigger hospital. You're not just a number, everybody's a person. Everything's a little bit more personal.
This team is the #1 team in all the hospitals that I ever worked at. And I have worked at some really good hospitals. The team here is dedicated. They understand that any moment it can be a family member coming through the door because we are a community hospital.
I've lived in Watkins probably 8 years. A friend that I walk with, she walked in and she said to me, "You look like," and she took me by the hand and she said, "We're going to the emergency room."
She needed to be transferred to a higher level of care from Schuyler. Went seamlessly. I was able to see her here.
They were very assuring and I was very well taken care of. And they all worked together. It's a good feeling. Because when you go in like that, you just don't know.
When she wanted to return back to Schuyler, I was able to continue her care back there.
It means an awful lot to me. I just would like to say thank you. And I feel at either place that I could get good care.
I have been working over at Schuyler Hospital for a number of years, and I started over there just before the merger of the two. And since I've been there and it's been part of the Cayuga health system, they felt like they're getting really good support and really good care for their patients and appreciate all the services that we bring to the area.
This is what they portray, that somebody thinks about you and cares about you. It's here with the two hospitals, and we don't have to go all around the world. It's right here.
I started in '97 when I left TC3, retired from more places than you can think of, but retired from TC3. And I said, that's enough of this working world. I'm going back and volunteer, and I've been here ever since. Of course, my main job is to greet the patients and their families as they come in the door there. The biggest joy I get is to see, I don't see the patients, once they go in there, but I see the family members. And what gets me is when the surgeon comes out and talks to the family members and tell them how everything went. There was just to see the sigh of relief and the smile on their face and to know everything is all right. It gives me just a great, great feeling. And I can talk with them. And when I wasn't here, I missed all the people, the nurses aides, the doctors, the anesthesiologists, and all the people who was here. I just missed each and every one of them. I just couldn't wait to get back to see them and work with them. because I work with all of them every day. And I just miss that so much, to be back here and just be able to help out in any way I can.
I had what was called aortic stenosis. My wife and I are active in the fire department, and we had a fire right here in town. And all of a sudden, that day I was getting a pretty significant chest discomfort, and I realized then that apparently things were changing. And so I went back. Dr. Brand ordered another echo, and from that point on, he said that we needed to do something fairly quickly because things had changed.
We were sort of going back and forth. The treatment for a narrowed aortic valve is based on the heart function itself, and his heart function was excellent. And their symptoms. And when they start to get symptomatic, it's time to fix the valve, because soon after patients start to get symptomatic is when their hearts really starts to fail. We give very good care here, but when we realize that patients need higher levels of care, it's nice to have a close partnership with Rochester to be able to transfer them up there, and they get great care up there.
From Schuyler to Cayuga to up to Rochester, it was just a really good experience, and made me feel very comfortable. It felt like they were treating you like we were the only people in the whole hospital. I'm doing just about everything now that I did way before. I don't know that there's anything that I haven't been able to do. I just grateful for the system. Schuyler Hospital saved my life.
Yeah, my mom, Rosemary, her journey has been complicated, but also rewarding since she's come to Seneca View. When she took her last fall, she needed some rehab, and they had recommended Seneca View.
I had seen brochures and things of it, you know, and so I liked the pictures and the scenery and everything, especially the views. There's a large lake you can view from the picture windows in the front of the place, you know, and it's so beautiful. Blue, the water is just gorgeous.
The people in rehab brought my mom to be the way she was right now. Karen and Maggie, both OT and PT, were the ones who worked with my mom, and they were fantastic.
The nurses and the aides and everybody is so wonderful, you know, as far as their personalities and their treatments to you.
Unfortunately, she fell a little over a year ago again, but after that fall, my mom made the decision and that she was going to stay here.
Got to myself, well, Susan lives here, so that would be good because I could finish out my rehab and everything here and then be in the home.
When your independence is taken away from you, as it has been for my mom, it is not easy for them, mentally or physically, to deal with that. And so what I love about it here is they did listen and they did respond, and they have let her do some things independently as well, like getting around in her room, and it's been very good environment for that, and that's been important to her.
If you want to do it, you can do it. Or we have music, one of our nurses, Mike, and he plays his guitar for us. Bingo, everybody goes to bingo, I'm telling you.
Seneca View in all aspects, from housekeeping to dietary, to the nursing care, to the CNAs, to administration. It's a personal touch. Every one of them give a personal touch, and that's what I love and motivated to stay here with her and for her.
It's a wonderful place. I love it.
Back in October, and we had the very first frost. I was coming around a brick path around a house. I wasn't even thinking that the wooden steps might be different in terms of slickness than the brick walkway. And when I hit them full stride, still looking at the car, I fell down in two places, well, 2 bones. I broke my wrist. So an ambulance took me to the emergency room at Cayuga Medical. I'm not originally from Ithaca. I grew up about 4 hours south of here, but most recently I spent the last decade living in Austin, Texas, and before that about 25 years living in California. It was kind of funny at the emergency room because the doctor who treated me was also from Austin, Texas, but luckily he didn't fall down that day. After he set my arm, he gave me a list of orthopedic surgeons and told me that I needed to go and see an orthopedic surgeon in about 10 days. So I looked at that list and I thought, well, I have one friend in Ithaca who's a fellow professor. Let me call her and see what she knows. And of course, she had broken her wrist before, as apparently everybody in Ithaca has done, and so she recommended Dr. DeBuck.
So she came in, and when I saw the x-rays, it was pretty apparent that it was best to treat it surgically. We, as an outpatient surgery, repaired the wrist fracture with plate and screws, which is a fairly common thing that we do.
So after the ER and before the surgery, I was walking around town with my arm in a bit of a cast and a sling. And everywhere I went, people would ask me what happened and who was my doctor, and I would say Dr. DeBuck, and everybody knew her. Everybody knew her. And I have to say, what does it say about a place where your first doctor is an orthopedic surgeon and everybody in town knows your orthopedic surgeon and says things like, oh yeah, she worked on my brother's arm.
I have been an orthopedic surgeon in Ithaca here for 21 years. You know, over 21 years' time, I usually do about 400 surgeries a year, so 21 times 400 is a lot.
It made me so comfortable to know that there were experienced surgeons here, and I didn't need to go anywhere else. I was just being seen here, and that was from the moment I had landed into ER through seeing Dr. DeBuck, and her whole demeanor put me so much at ease that I never had any qualms. I never thought of going anywhere else.
This year in March, I had my right hip replaced. I was referred to Dr. Menino by my primary doctor, and I was glad he did.
At Schuyler Hospital, there's really a pride with the institution. In other places, they have physician extenders, other people available, but they don't form the same sort of doctor-patient relationship. There's not that kind of caring that goes on. The time I spend with Ted, he sees me each and every time he comes, and that's a distinct advantage because the relationship is felt to be therapeutic to a certain degree as well. You have to be able to work together towards a goal in order to get people better.
The hospitals that I've been at, other ones were more like an assembly line. People are just not friendly and they just move you along.
The nurses are so polite. Physical therapy is the exact same way. You go down there and you feel like you're part of the family.
When I was in recovery, there wasn't a nurse or a person in this hospital that didn't come in and check on me every day. It's a very different kind of place. It's just wonderful in here. Now that I'm got through recovery and everything, I'm back to doing gardening. I do more of the vegetables.
And I do more of the flowers.
Usually, yes. My favorite thing is to get out and walk my dog all the time.
The dog really loves being out with Daddy, and he is walking so much better.
Schuyler is a wonderful hospital. I want to go anywhere else. Everything we need is right here.
Right here.
Funny story, maybe infamous story amongst the people I've worked with, and that was I was in a running contest. It wasn't to see how far you could run or how fast you could run. We were trying to see if we could run every day. And it started off with trying to run every day for a year. Well, by the time I got to 2018, it had been over 16 years of consecutive days of running. It was a little extreme after a certain point when you realize, 6,000 days in a row of consecutive running. And I noticed in early January of 2018 some left hamstring pain. So I kept running through it. What really hit me, though, that I had a problem was that I was taking athletes to the National Championship Series and then an athlete on to the national finals in Oregon. And I really couldn't walk more than 50 meters at a time. I was not suspecting any kind of back issues at this point because my back didn't hurt. It was all my leg and numbness in my leg. I was encouraged to get MRIs that revealed the herniated disc, and that's when I got connected with Dr. Demopoulos.
I met Arthur here in the office, and I understood that from the beginning that he was a remarkable person. He was a very accomplished athlete and coach, and after I examined him, and I thought that he would be in a need for surgical intervention.
First appointment with Dr. Demopoulos, I would describe as very reassuring. One of the things that stuck with me from that very first meeting was his real sincerity in stating that he wanted to treat me like I was a member of his own family. He made it very clear that you don't go into surgeries like this with your back lightly. I think his bedside manner in explaining things without being judgmental and providing a reassuring path forward really put me at ease.
Well, I enjoy taking care of my patients. I enjoy trying to see what is the unique way that the patient will benefit and improve their quality of life.
The folks that I worked with at Cornell really had wonderful things to say about Dr. Demopoulos. So just in my own network, in my own community, I had heard really good things about the care here and the care that he provided. Whenever I've needed something, Cayuga Medical Center and the services that you all provide, I've always been able to get them. Couple that with meeting with Dr. Demopoulos and feeling very reassured that he had the background to be successful.
I decided to be a neurosurgeon when I was serving in the Army, in the Greek Air Force. I was fortunate to be assigned in the neurosurgical department in the biggest hospital of the Greek Air Force in Athens. And I was fascinated by the impact that neurosurgery can have in the quality of life to the people that have a brain and spine disease. Becoming a neurosurgeon, I needed to have very good training, and at that time the best training in the world was in the United States.
My experience with the staff at CMC was terrific. They were really invested in my background and wanting to get me back up on my feet. My distinct memory is when I woke up and they first let me stand up, the relief, the pain relief was instantaneous and total.
In the past, we used to intervene in the spine through usually a large surgical exposure, but this came with a price in terms of the blood loss, the length of the recovery, the postoperative pain. With the minimally invasive techniques, we try to achieve the same goal of improving the quality of life and making the changes that are needed in the spine without completely altering the anatomy. Combine this with intraoperative navigation techniques that would allow precision and significant improvement of the surgical impact on the patient's health.
I was actually back running about 4 months. And this time when I started running again, I am no longer doing a daily running streak. I've learned the value of taking days off. The care that I received in Ithaca was world class. Dr. Demopoulos did a procedure that is complicated and is very advanced. It's a microdiscectomy, it requires a lot of precision. He's a real expert, and I think we're very lucky in Ithaca to have somebody with that kind of expertise. At the same time, the thing I really appreciated was that there was real, warm, personal, individualized care. These folks were very invested in my return to the lifestyle that I enjoyed before then. So from the healthcare staff at the hospital, just wanting to know my name and get me through the journey, to what I still remember very vividly in that first meeting, Dr. Demopoulos promising me that he would care for me like he would any member of his family. That's something that makes me feel good about this community, that we have that combination of world-class care and real personal, sincere devotion to the members of our community.
Hi, I'm Dr. Lloyd Darlow, family physician, VP for Clinical Integration at Cayuga Medical Center and the president of the Cayuga Area Physicians Alliance. The COVID-19 crisis has taught me a lot of things. Number one, I'm really glad to be living in upstate New York. The response to the community, to how we've all come together during this crisis, has been nothing short of inspiring. Thank you to everyone who's contributed your time, your efforts, even just a kind word at a time when we're all feeling down. But it's also shown me the importance of having a strong, local, and sustainable hospital and healthcare system. Many of my colleagues and friends from around the country have had to struggle to find healthcare and to be tested at a time when we've been told that testing is so important to controlling the spread of the virus. The ability for Cayuga Health System to rapidly snap into action and set up a way for us to be treated and tested really has been unique, not only in the region, but maybe even in the country, and how quick it all came together. Those kinds of things don't happen by accident. They need constant support in order for us to be able to be nimble and provide the kind of help and care that we want to for our patients. So what I'm asking you to do today is to consider contributing to Cayuga Health System. You can do that financially through the Cayuga Giving Day at cayugagivingday.org. But I also want you to consider a different kind of support. When all of this is said and done, and it will be said and done at some point, we need your support by considering what it means to support your local healthcare system. We have an incredibly talented team of providers right here for you to provide the kind of care that you and your family need. Consider having your knee replacement done here at Cayuga Medical Center. Have your colonoscopy done here by one of our talented gastroenterologists. Have your mammogram done here, your lab work done here. Support the Cayuga Area Physicians Alliance providers who have been here providing for you and your family for almost 30 years. That's the kind of support that we need to keep our mission going when we say the best care is right here. Thank you very much.